tuck is a very generic term used by the lay people to cover a broad range of procedures. Anywhere from just a little bit of extra skin tightening on the abdomen all the way to a full-blown body lift. But in general, what you're talking about is the removal of the skin, some fat, and then the tightening of the muscles that typically have been stretched out from childbirth. So that is, for a plastic surgeon, that's what a general tummy tuck / abdominoplasty would really be. Most of the time that is combined with some liposuction in some extra areas, but it usually involves the repair of the damage done from childbirth. Tummy tucks are a very real surgical procedure. It's probably as big a procedure that any plastic surgeon does in terms of recovery and what the patient has to go through. You're talking about a good 2 weeks of recovery, probably not feeling normal until you're about 6 weeks out from it. So discomfort would be the first issue. Then the scars are a pretty good scar. It's a scar that goes all the way across the lower abdomen, basically covered by the underwear, but the patient needs to see photos of what that scar really is. Then you get into the more generic things of just the risk of surgery, of infection, bleeding, and numbness down in those areas. One of the things we spend a lot of time and have to take extra precautions on in abdominoplasties is blood clots in the legs and in the pelvis. It's very important for the patients to get up and get moving right away after their abdominoplasties, because the risks of blood clots, pulmonary emboli, is higher in abdominoplasties than in just about any other cosmetic surgery we do. Abdominoplasties are, even though they're a big procedure to go through, are one of the most well tolerated and some of the most satisfied patients we have, because you're basically taking an abdomen that's been completely undone by pregnancies and giving them back a relatively flat, taut abdomen that will then respond to exercise. So it's great for the woman that says, I've done 1,000 sit-ups a day and no matter what I do, I still have my little pooch down below my belly button. You tighten those muscles back up and now they can do their sit-ups and they really, really see a dramatic improvement from those sit-ups. So in general, a very, very well accepted procedure.